In high school, they gave us aptitude tests. Mine came out to be an administrator for a nonprofit. And I thought, oh my gosh, how boring that would be. So I ran the other direction, and I was a journalism major, and I worked for a couple of different papers. And when I was asked for this job, it was like, oh, an administrator. Huh, funny, I've been running from that for 25 years.
The big thing to know about Kathy, and anyone that knows Kathy absolutely knows this, Kathy is where passion, attention to detail, and intelligence all come together.
She's so dynamic. There's never a moment where she's not thinking about something else she wants to do.
She was always an excellent business person. She was very well organized, and she also had a deep heart for social needs, and especially for the needs of those who sort of fall between the cracks.
When I started, the clinic, the volunteer clinic, had a budget of about $350,000, and we were seeing maybe 1,000 patients a year. And now the clinic has 15 sites, 5 medical clinics, 2 dental clinics, 8 school-based health centers, and a budget of about $23-24 million, which just kind of happened over time, is how it seemed.
She knew that Northwest Arkansas needed expanded health care, even though the rest of the state thought Northwest Arkansas was rich and didn't need anything. And she knew differently, and she wanted to make certain that it was not ignored.
When I first started here, there was 12 employees total, and they were kind of just seeing random patients, but Kathy really wanted us to focus on the unmet need in the area.
We were working with a population that most of the medical community wasn't seeing and really didn't have their pulse on it.
So once we had the Spanish-speaking population, it kind of just went like wildfire. Like they really entrusted in us, and they believed in our mission, and they knew that we were here to help them. And then the demographics in the population even changed some more in Northwest Arkansas, and a lot of Marshallese moved into the area.
She was determined that we would have first-rate, state-of-the-art pediatric dental.
It was kind of like, you build it, they will come, and they did.
And we had a lot of the children that we started treating in the late 90s come back to us with their children for care. And they had done wonderfully. They had taken our hygiene information and did right by their own children.
So then that's when Kathy actually hired a grant writer for us to become the 501c3 that we are and become a federally qualified health center.
We were looking to expand, and how would we do that? How could we hire providers to care for people when we were charging $5 a person for care? So we started doing research and found that there was a community health center world out there that hadn't really reached the western part of Arkansas.
Kathy was part of that tireless team, the leader of that tireless team that brought the health center model to Northwest Arkansas and grew it into one of the top federally qualified health centers in the whole country.
She's been able to look in every corner and find every resource to enable her to keep the community clinic going, and it's been very successful.
So to be able to create a program that was very hospitable to Hispanic and to the Marshallese neighbors, one where they felt confident, they felt heard.
More than probably about 80% of our staff now is bilingual, if not multi-languaged.
We also put up maps of the Marshall Islands so that people could show us where they came from.
She was always like 10 steps ahead of everybody else.
She was born to be a boss because she can get everybody lined up doing what they need to do for a singular mission.
It takes a very capable CEO who's pretty tenacious and resourceful, to make all that fit?
She gravitated to me because she was all about the mission and extending beyond her footprint with that mission and helping the whole state.
I knew Dr. Tom Bruce. He was a wonderful inspiration to many of us in terms of community health and taking care of health disparities and impoverished populations. He was a wonderful leader.
Kathy reflects the lifetime commitment of Dr. Tom Bruce, who was a pioneer on community public health and primary care, who worked diligently to improve the access and quality of care for low-income Arkansans and marginalized across our state. Kathy has those attributes, and it fits her to a T.
We're a better community for sure, thanks to Kathy Grisham.
I'm really proud of her for getting this award. It means a lot.
Kathy, on behalf of our Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being the recipient of the 2020 Dr. Tom Bruce Arkansas Health Impact Award. Well deserved. Congratulations.